Rough week for a lot of folks out there, first preparing for the storm, then actually either riding it out, or maybe you had to go to a shelter and then you came home to a lot of damage, a lot of wetness and mold possibly forming in some of that furniture. Let's say you kept it in there. There are some risks potentially to your health. So joining me now to kind of cover some of these, Dr. Ali Kashrian with Kashrian Urology. Appreciate you coming in today.
Thank you for having me.
You know, when we were out in St. Augustine, we were passing out bags of ice and you saw people who just got rid of their couches. They got rid of a lot of their furniture because it was wet. Now, I can imagine that a lot of people didn't do that. So if you had, 2-3 feet of water in your house and it did penetrate some of your furniture, what's the danger when it comes to mold?
So when you look at mold and just prolonged exposure to wetness in general, whether it's your skin, whether it's your building, structure or furniture, it does expose you to fungus. And so mold is a fungus. And so that can cause all sorts of problems. So you want to be very, very mindful of having someone that's reputable with knowledge evaluate your structures and your furniture and things of that nature that you're concerned about to make sure if the threat is real,
right,
and then make sure that it's taken care of by people that know how to do it.
Because even if it looks like it didn't get any damage, if water's inside of there, it is going to take much longer for it to dry, and that's when that...
Especially in the walls
right,
and places like that where you may not be able to see it.
Yeah, so I read somewhere it's like, you need to either have it dried out within 24 hours of the wet contact, or you might have to get rid of it.
Because you want to make sure that the sustainability of whatever you're going to keep doesn't endanger you in the future.
Because what are the symptoms of mold?
So when you get a mold infection, a couple people that are really at risk are people that have chronic lung issues, people with asthma, people with emphysema, things of that nature. The other population that a lot of times doesn't get mentioned when you read about this are diabetics. Diabetics inherently have a slightly weaker immune system, so it sets you up for a higher risk of infections. And if you're exposed to a mold that you may not perceive for a while, it could potentially set you up at a risk. And so it could be a constellation of different infections.
Right,
you can have lung infections, you can also have skin infections.
Right, and that's another one that, after storms they've looked at, people are exposed to those. Let's talk about cardiac events, because when we are stressed, if you do have a pre-existing condition, maybe one that you don't even know about, you are more at risk to have a heart issue.
So it's interesting, when Sandy hit up in the New York, New Jersey area, they found, when they looked at this, they found that in the 2 weeks following Sandy, there was a 22% increase in heart attacks.
22%, yeah.
And a 7% increase in strokes. And it's associated with stress. So one, just underlying people, just in general, it increases your stress, so that increases your risk of events such as that. But if you have an underlying cardiac issue or a cardiovascular issue, make sure that you take that into mind and you decrease your level of stress, not only during the storm, which is now past, but for
really
the time afterwards.
Yeah.
The other thing to keep in mind is if you're out cleaning, if you're out doing different things, don't be afraid to ask for help if you're someone that has a cardiac issue, because those are the times that you could potentially put your heart at an increased risk and you can potentially incur an event such as a heart attack.
And the thing is, we talk so often about heart disease and knowing the symptoms are so different, varying from men and women. So if you just don't feel like yourself and you can't seem to get rid of that issue, then you definitely want to talk to your doctor. It was interesting because during the storm, like right after, they said Zika may have diminished because that storm kind of wipes out some of the mosquitoes and the larvae. But now you have a lot of standing water out there. So if you don't go around and dump it, we could have another issue.
Be very, very mindful. So standing water is where mosquitoes breed. So if we're increasing the ability for mosquitoes to have a flourishing bed to populate and increase their populations, we want to make sure that we try to minimize that by getting rid of standing water as best we can. If you have flood areas and things of that nature, that becomes a challenge. The other thing is be mindful if you're in an area where the flood water has exposure to sewage. That again increases the risk of what you're doing. So be mindful, not only the mosquito exposure, but if you're wading through those waters, make sure that you cover, make sure that you wear boots or covered shoes so you're not exposing yourself not only to the dangers within the flood water, but mosquito exposure.
And tracking it into your home too. We were in St. Augustine and it was bad. You could smell the sewage there. For the latest health news and for the latest the aftermath of Hurricane Matthew, go to news4jax.com. We'll have much more. Thank you, Dr. Kashrian.
My pleasure.
Jen, over to you.
Yeah, taking a live look.